Hi, and welcome to the post-COVID-19 Interdisciplinary Clinical Care Network Education Series. The following video is the final module in a three-part series for helping your headaches. We recommend starting with session 1 and 2 before carrying on with this session. We hope you tried out the brain break we recommended in our last video. Taking brain breaks is an important way to help any post-COVID-19 symptoms, especially headaches. As always, a reminder that these educational modules do not replace a visit with your family doctor. Remember to take your time to watch these modules. Aim to try to limit your screen time by watching just a little bit at a time. In this video, we will be adding some tools to your toolkit and how to help headaches. We'll share more ways to prevent headaches, tips to manage your headaches, and build on the action plan we talked about in our first session. If you were unable to prevent a headache and now are left trying to manage one, some helpful strategies you can use to deal with a headache are things like using a hot or cold pack on your forehead or the back of your neck. Some people find that applying pressure through tying a piece of cloth tightly around your head can help. Individuals are sometimes able to ease tension through self-massage or gentle stretching of your neck and shoulder muscles. Physiotherapy or registered massage therapy can also help reduce tension-related headaches. Plus, they may guide you in other ideas of how to prevent or reduce your headaches. Sometimes our surroundings can be a trigger for the development or severity of headaches. Paying attention to your environment may offer you insight in avoiding or managing headaches. Some people are bothered by bright light. You may find relief in wearing sunglasses, a hat, or avoiding bright lights or the sun by finding shade or a dark room. Smells can be especially triggering for some people. Avoid harsh smelling detergents and cleaning supplies, perfumes, and smoke. Temperature can often be quite triggering for individuals. Avoid long periods in the heat or sunlight and try to stay in places with good ventilation. Other helpful tools for a healthy environment include limiting your screen time. We've moved to a world where everyone has multiple Zoom meetings, works at their computer, watches TV, and we're always on our phone. To help minimize the impacts of screen time, try an overall reduction in screen time, try using glare-reducing screens, blue light blocking glasses, and ensure that you're taking brain breaks and keeping an eye on your posture. Noise can be especially bothersome for some people. Try limiting the amount of noise around you. Turn off the radio or the TV. Some people find relief with noise-canceling headphones, though make sure you don't rely on these all the time. While we can't always control every aspect of the environment around us, it is important to take control of the things we can and pay close attention to the things that trigger headaches and work to avoid them. The world we live in today is very stressful. In a normal world, dealing with families, relationships, work, and balancing all of the areas of our life is stressful. Now, there's an additional layer of stress called COVID-19. Regardless of what is causing your headaches, it is likely that stress is making it worse. Things that you can do to reduce the impact stress has on your headaches are things like muscle relaxation, trying to use mindfulness and meditation moments into your day, try a gratitude journal, visualization techniques, or at-home yoga. And as always, using pacing strategies in your day-to-day activities can help to provide your brain with some much-needed rest, as well as reduce your stress. Following COVID-19, there has been an increase in the number of people experiencing depression, anxiety, and PTSD. Not only can these make your headaches worse, they can also increase how often you get them and how well you can control them. If you're noticing big changes in your mood, seek social support. You're not alone in this. Try online mental health resources, supports through mental health offices or hotlines. If you are able to, try private counseling or psychological services. These may be reimbursed through your workplace or extended health benefits. And of course, make sure you speak with your family doctor. They are best positioned to help you work through this challenging time in your life. So, you have a bunch of new tools in your toolkit. Now what? We invite you to take action and try some of the strategies that were discussed in these presentations. Focus on ways to improve your sleep, mood, and stress. Take brain breaks at work, at home, and even when you're socializing. Make sure you stay well hydrated and eat a balanced diet. Slowly return to physical activity and make sure you take some time to be outside. Reach out to friends, family, and your healthcare team for support. And make an action plan for at least one thing you could improve in the next week. So, my action plan is going to be to reduce my screen time. So, to improve my headaches, I plan to limit my screen time. I will stay off screens until it is time for work in the morning, and during work, I will make sure to take a standing break for 5 minutes every hour. Before bed, I'll make sure that I don't have screen time in the hour before I go to sleep. I'm going to try these strategies for at least 1 week every day. I'm going to share my plan with my sister. And even though I'm nervous about these changes, I'm a 7 out of 10 confident that I can stick with it. Thanks for watching, and please let us know how we're doing at post-COVID-ICCN@phsa.ca. Thanks.